Hey, deserving listeners, 90 Day Fiancé, happily ever after. This week's episode, let's get into it. I'm going to react. My name is Dr. Kirk Honda. I'm a therapist and a professor. As I always say, every single video I ever make, every audio episode, every video episode might have triggering content, and you need to be very careful as you watch. Let's watch the show.
To have the consultation with him, I had to put a robe on and derobe. That's the doctor. He has to see how heavy they are, feel them, medically massage, examine them. He medically handled them.
All right, so I commented on this last week. She is sexualizing the experience with the professional, which is not okay. If we reversed the genders, it would be easier to detect the inappropriate nature, the perhaps kind of assaultive nature of that. Imagine if older male goes in, I don't know age has anything to do with it, but a man, identifying man, goes in for a medical examination with a woman professional, woman physician, and the patient, the male, says, oh, and maybe has something to do with the privates, and he's like, oh yeah, she massaged them, or hey, look at that, and oh, you're attractive, boy, you know, if it weren't for my wife, I'd be going after you, as the female physician is examining the patient. We could very easily see the creepiness of it at the very least, and potentially the maybe illegality of it. That's just not okay. And it doesn't change if it's a woman patient. It changes the context, obviously, because men are much more likely to be assaultive of women than vice versa. But it's not like women don't assault men, and it's not like men can't feel uncomfortable in a workplace when a woman harasses them. And here she is again, bringing it up with her husband. My dog is barking at the neighbors, I think. And the patient, Angela, is bringing it up with her husband that the physician, I think she said medically massaged. I don't think he was massaging at all. I think he was performing a necessary medical examination. And I'm guessing this is triggering. And again, what I said last week as well is, imagine if Michael, had done something along these lines and provoked his wife, Angela, along these lines. Imagine how upset she would be. So I'm just trying to understand the wisdom as to why she's doing this.
I like to pick on Michael. When I said Agana, because that's one of his native brothers, his mouth went to squinching. It's kind of cute because Michael is jealous of this 54-year-old woman. So, I threw that in there.
Now, maybe the two of them have an agreement where they both know that she's much more sensitive to jealousy than he is, and so they have a double standard that is okay with them. But to play around with this kind of jealousy with Michael, imagine if it were reversed, and the track record that Angela has exhibited with Michael, the severe anger and control, and the pressure that she's put on him. Now, some of it is perhaps the feelings are perhaps justified, given that Michael has literally cheated on her, but other things that we would potentially look at as not justified as to Angela would be as angry as she would be towards him. So I'm just going to give Angela the benefit of the doubt and say that she thinks she's being funny and doesn't realize the double standard that she's creating.
So to help me, he can reduce the size. They'll be up, perky, but you won't be able to pull on them like you like. Michael, oh God.
The reduction is just a little, right? Just a little.
I don't know.
So this is why it's a good idea to bring in important family members into medical consultations. If Michael were there with the physician, I'm guessing Michael would understand as to why the physician was recommending a breast reduction. And the way that Angela is delivering the news to him is perhaps not as well refined or well explained. And maybe even Angela doesn't understand why the physician was highly recommending it. So this is a reason why family members should be there. Sometimes physicians don't want family members to be there, which I find to be unusual. But for me, in my practice, when I say, let's say I have a client who is suffering from heroin addiction, or we have a client that is suffering from depression, or we have a client that is having tremendous emotional difficulties from PTSD, complex PTSD, borderline. And I really enjoy talking with their family members. Bring them in. The family members won't be clients of mine, and I always am clear to explain that. They are collateral contacts or support people for the patient. But for me to be able to explain to them so that we can get them on board to understand what the treatment is and is incredibly important. As a marriage and family therapist, I understand that, of course, because we understand that to treat an individual is to miss the broader context of that individual. So in a parallel way, the physician could have called up Michael, say, do you think your spouse would be concerned about some of the things we're talking about? And Angela would have said, probably, yeah. Okay, well, let's get him on the phone and let's get him involved. Let's help him to trust me. If he has an opinion, he can chime in. But of course, to the physician, that complicates things. But to not do that risks in this moment, I don't think it's going to happen. But the physician highly recommended it for a variety of reasons, health reasons and comfort reasons, wellness reasons. Angela was on board, and now Michael might get upset at that and put the kibosh on the whole procedure. And so it would have been better, medically if Michael was involved in that consultation. Now, it depends, right? Because some family members don't want their family, some patients don't want their family members in the consultation for good reasons. So, it depends. But anyway, it's just a thought I had.
I'm not happy about all this. There's nothing I can say now. Go ahead. Just do it. Just do it.
Why are you mad?
I wish I can talk to the doctor about you adjusting your boob size and all that.
Okay, so he is talking about how he is upset about the medical procedure that she's about to have. Maybe they'll get into exactly why he's upset, but I don't know what to think about it. On one hand, he is free to have his opinions and say, look, honey, I love the way that you are, and I don't want you to change, and I don't want you to put your life in danger and your well-being in danger to change your body in some way. I love you the way that you are. I married you. I met you the way that you are. I married you the way that you are. I don't want you to be different. It's up to you, of course, but there's that. I don't know if it's that or if it's some other more objectification issue of I want you to be this way and I have the right to tell you how your body should be. I don't really know what's going on.
You know what really aggravates me is the audacity of Michael to be worried more about my big boobs than the risk I'm taking. Like, you should be more worried about my health and how my breathing is than you're not going to be able to have big boobs to play.
Okay, and true, but does he know? Have you explained that to him? Maybe she has, but there's a good possibility that Angela hasn't said any of this stuff to him, that she hasn't. I wouldn't be surprised if Angela, given her insecurities about her age difference with him, that she doesn't tell him about the health problems that she suffers from. So has she explained it to him? Look, this and this and this and this and this is why I'm doing all these things. And honey, I'd like you to please take that into account when you think about your preferences being not at the forefront here. But maybe she has, and he is being a jerk face.
Smaller but prettier, I guarantee it. I guess I gotta get going, Michael.
All right, just call me. I'll be waiting. Okay?
Hi, baby. Now you got me worried. If my boobs turn out too small, this can really be bad for me and Michael's relationship.
If one's relationship is based on that, then good riddance, right? Imagine for y'all if your spouse was only in it to win it because of some aspect of your body. That would not be a happy place to be. It's not a strong foundation of a relationship. So, Angela, if Michael divorces you over this, then good riddance. I don't think he will, though.
One, I'm gonna be pissed that he don't love me for me. And two, you didn't marry me because of my big boobs, did you?
I would like to think that he didn't, but I guess we will all find out. The litmus test is happening. Let's see.
Or did you? I can see it in his face. Did you see it?
So I think it's possible that for Angela, this is wrapped up in her body issues. I don't know if she's mentioned that she does have some body issues, but I wonder if for her, I mean, obviously there's a lot of anxiety about having a surgery like this for sure. If I were in her position, I would be terrified. So she's having a lot of emotions there, which are understandable. But I also wonder if there's some kind of insecurity she has about her body that that's being manifested here. I wouldn't be able to speculate what that is. If she were, in the room with me right now and willing to talk with me, I would ask her some questions to get at the bottom of it. But it seems like she's really fixating on that much more so than Michael is. Michael's interested in it, but I don't know if he's as fixated as she might be thinking. So I think she might be projecting a little bit.
Yes, Chef.
Nigerian men value big boobs. It is something to be proud of, no? It shows a sign of good living, and the husband takes good care of his wife when she have that kind of, stature.
So earlier, when I was hypothesizing about the various different reasons as to why he might be upset about her having the reduction surgery, I was saying on one hand, maybe he's just saying, hey, honey, I love you the way that you are. I don't need you to change. Or on the other hand, was he saying, look, in order for me to love you, I need your body to have certain attributes, which of course would not be a good attitude to have, and it would be very hurtful and not a very healthy one. But he is proposing a third one, which is kind of similar to the first one, which is a cultural element, which of course makes a lot of sense, that his culture would be different than Angela's culture and that they aren't really understanding each other. For him, he's saying that in my culture, when a wife has a certain body shape, then that is a sign of pride for everyone in the family, including the husband. And so that's why I don't want her to change. But I'm hoping that Michael sees the bigger picture, that one, Angela wants this change, and two, that, she wants it for her own health and her own comfort. And hopefully that will override this cultural element for him. All right, well, that does it for that episode. If you didn't know already, we have a Cameo. I have a Cameo where I can send happy birthday messages or happy Father's Day messages. I guess that's coming up next. Congratulations, that kind of stuff. It's fun to do. And everyone out there, please take care of yourself because you deserve it. You really, really do.